What's up, Acadiana, and welcome to Offside. I'm Shannon Wilkerson here with Derek Albert, who is sitting in for Brandon Como this week. And joining us here on Offsides, we are pleased to have Senator Bill Cassidy. Hello, Senator. How are you today?
I am good. Thank you for having me.
Well, it's great to have you, sir. And I'm personally excited to have this conversation with you because I know that you have unveiled some new ideas to help healthcare and the costs involved. And it's ironic that we're talking about this today because just over the weekend, my wife and I were looking at what we bring home financially and what healthcare is costing us as a couple. Now, I'm middle-aged. My wife is a bit younger than I am. We're both in very good health. My wife is in perfect health. And I know that it wouldn't surprise you to learn that when we look at what our health care costs us versus what we take home, it is almost 20% of what we make right now just to have health insurance. And so I'm glad that we're able to talk about this today. You there, sir? Senator?
I think we may have lost
Yeah,
him.
I'm sorry. Just for a second. Can you hear me?
Yes, sir. I can hear you perfectly.
Oh, good. It doesn't surprise me. If you look at the statistics, since Obamacare passed, it was a problem before Obamacare. But now with deductibles and co-pays climbing, the cost of insurance has risen, but the family's out-of-pocket expense has climbed even faster than the insurance premiums have climbed. We got to do something to lower health care costs. Trump is about draining the swamp. Let's drain the swamp on health care cost.
Oh, I agree completely, and that's a powerful way to describe it. And one of the ideas that you came up with, all very creative and impressive. One of them is you described empowering patients to reduce their health care costs. How would you suggest? What would you like to see happen when it comes to empowering people? What kind of rights would they have? What would change specifically?
Number one, price transparency. Wouldn't it be great if you knew the cost of something before you got it as opposed to get a bill 6 months later? And you could, oh my gosh, I can't believe how much it cost. And you could actually go to some place where you would get the same product less expensively. Consumer Report, for example, Consumer Report, the magazine, you can go online, find the article, did secret shoppers buying generic medicines. And they found that in one pharmacy, it was $44 for a medicine if you paid cash. In another pharmacy, same drug, $700.
Absolutely.
You don't know that because you can't compare prices before you go in, and they won't tell you the price. You should be able to get the price of that medicine before you go so that you can choose where to go. And by the way, once you can do that, it's going to be $44 wherever you go.
Well, that
makes perfect sense.
That's right. Once the truth is out there, that's exactly what will happen. But you bring up a good point when you mention pharmacies and the incredible difference in the prices that can exist for the same exact medication. One pharmacy, like you just described, $44 if you pay in cash, versus another pharmacy that is $700. Now, I'm curious what your opinion is about this. I am a big advocate for letting the market determine things. Free market enterprise, people that are in business for themselves need to have less restrictions. However, when it comes to medication, and I think that falls under a different title of restrictions and boundaries, at least in my opinion. And so I'm curious what your thought would be when it comes to putting restrictions on what pharmaceuticals and what pharmacies can and cannot charge for these medications.
We take two approaches. One thing we've seen is where a company will buy up the rights for a certain drug, which is inexpensive. And then when they're the only producer, they will increase the price, in one case, 750%.
Yeah, I saw that happen with the guy that bought the rights to the EpiPen.
Oh, that was Shkreli. I was thinking of the one with Shkreli and Daraprim. So the way we address that is, I can promise you, Daraprim that is sold in England is just as good and just as safe bought in the United States. And if a wholesaler wanted to go to England and buy the medicine and then ship it back over here, we would make that easy to do. Right now, you have to go through permitting, jump through hoops, do that. Never happens. Boom. If you want to, there's only one producer of a drug. You can go to a country like Germany, France, or England and buy it and ship it back here and sell it. That creates a sort of market-based competition. The second thing, for name brand drugs, they have a cost.
We're losing them. Senator, are you there? I think that
Motrin.
Okay, there you are, sir.
So there's a medicine called Duexis. They took ibuprofen and famotidine, which is Motrin and Pepcid. You can buy them over the counter for $20 for a month's supply. They combined them to make a drug, and they sell it for $2,600 a month. But $20 of medicine, they're selling for $2,600 a month.
And all you would have to do is take 2 over-the-counter pills to make the same medicine. Yeah.
So we would have a cost-benefit ratio. And so if it's a federal program, a government program, if a patient wanted it, we'd say, well, you can buy the same thing for $20. So we'll give you $20 for it. But if you want it, even though you could have the same medicine for $20, if you want this particular brand, you pay the difference. And so we allow that market force to bring the cost of medicine into alignment, not where somebody can get whatever they want, but rather they have to charge something that's kind of bears relationship to the rest of the market.
Yeah, that's a cool idea.
Once again, makes perfect sense on a commercial and a medical level.
Yeah. You know, when I have these conversations, especially with somebody who's knowledgeable about, as knowledgeable as you are about them, there's always a lot of creative, good ideas that come up. And you're sharing some of them right now that I think would be, if implemented, they'd be very effective. What is it that keeps these ideas from coming into play to actually happen?
I think we're at a good moment in time. President Trump is all about this. President Trump, I had the privilege of being at the Rose Garden ceremony where he was speaking to these issues, and he's all about it. And so I think that what we have now is a president who thinks that we should do something. And unfortunately, we have so many bad examples that tell us that something has to be done. I'm hoping, working with President Trump, that Congress can get this to happen now.
Okay, let's ask one more. Let me ask you one more question before we move on, if that's all right. If there would be one most significant change, all the different ideas that you're sharing with us right now, and a few more that I've read, I mean, they're all very impressive. What would you recommend would be the most effective thing that we could do that would improve our healthcare system? The first thing.
Two things I'm going to give you.
All right.
Price transparency. If the patient knows how much it's going to cost her before she goes to the doctor, she could choose to go here versus there and pay $250 for an X-ray versus $3,000. That would just begin to decrease cost rapidly. And that's a good thing.
And that lets the market dictate itself, basically. You know, like private industry should.
Yeah. Well, I've always been an advocate of opening up, make a statewide competition available. I've always believed that would be very effective in lowering the cost of health insurance, because then when you have intrastate competition, it would work as a parallel as to what you were describing about buying those medications in other places. They're so much cheaper that eventually it would drive down the cost where we are.
And I can tell you that price transparency, just like it lowered cell phone cost and it lowered this, it lowered that, it would lower healthcare cost.
Yeah, good point.
Good example, by the way, is LASIK surgery for your eyeball. Now, LASIK surgery used to cost me, I don't know, $1,000. I'd never had it, but it could cost $1,000 an eye. Mm-hmm. Now it's like $275 plus a little more for astigmatism. Mm-hmm. It's advertised on a billboard. Quality is going up, prices come down. Price transparency can work in healthcare.
Yeah, and simply because there are more professionals that are doing it. That used to be such an exclusive procedure. There were only a few doctors in every market that would practice it. Now it has become more commonplace, and just like you said, that has driven the cost down. Okay, so if I may, I'd like to ask you about your recent opinions about withholding money from drug cartel. Share with us some of your thoughts about that.
So drug cartels move about $110 billion a year from the United States to Mexico. $110 billion with a B.
Wow.
We confiscate only about $7 billion of it, less than 5%. Now, this isn't the supply of drugs. This isn't the demand for the drugs. This is the financing of the deal. If you can crimp the financing, you can shut down supply. My thought is, let's do a better job of confiscating the money and use the dollars we confiscate to secure our southern border. It won't be the Mexican government paying for the wall. It'll be the Mexican drug cartels, and that's someone better to pay for it. And it also works against them in another way. So we're working, how can we figure out how to do a better job of confiscating this money that drug cartels are moving out of the U.S.?
Yeah, well, that's what I was going to ask you. How do you confiscate that money if they're not U.S. citizens and they're not banking here? How do you gain the authority and the ability to go in there and actually seize those funds?
So one of the things they're doing is called trade-based money laundering. It's not just the Mexican drug cartels. Hezbollah was doing it as well. And there was a series of articles in the Washington Post. Hezbollah sells drugs, takes the profit, buys used cars, which it then ships to West Africa, sells in West Africa, and then it will use its profit to buy weapons to fight in the Middle East or to sponsor acts of terrorism.
So they're using the purchase and the sale of used cars really to launder the money.
Absolutely.
And
there's Lebanese businessmen. By the way, Lebanese community, they're very talented people. Lots of Lebanese in Louisiana, very talented people. Charles Bustani, former congressman, for example.
Sure.
So we're not painting a broad brush, but we're just saying that if you look at businessmen around the world, Hezbollah has a relationship with enough of them that they can act as folks who would do these transactions that effectively have laundered the money. DEA went after them and was able to shut down parts of it, including a bank in Canada, but there's more we need to do, and it's not just Hezbollah, it's Russian mafia, Chinese mafia, as well as Mexican drug cartels.
Yeah, it's very interesting and an aggressive approach. I'm curious what your opinion is about the growing trend in the cartel and drug dealers in general of the use of cryptocurrency. Because we've done some shows here on cryptocurrency, Bitcoin, if you will. Bitcoin is just really a subtitle of it. But the big growing trend, according to the data that we've done some research on, is that's the new money for the the cartel is cryptocurrency, because it's harder. It would be harder for governments and law enforcement to be able to seize those funds like you're describing.
It is harder, but the European Union has come up with a set of rules that govern the trading of cryptocurrency. Mm-hmm. And so it may not be that you can stop the transaction, but you certainly can investigate the person who does the transaction and get a sense of whether they're paying taxes and are they laundering dollars. So I agree with you totally. We're looking hard at cryptocurrency and its role in laundering money. There's some thought, by the way, that these wild fluctuations you'll get in the value of Bitcoin may be somebody money laundering in China, dumping a lot of money into purchasing Bitcoin. The price crashes when they decide they want to sell their stake. So this is being manipulated in a couple of different ways, but we've got to get a handle on it.
Senator, we have about 2 minutes left for this interview. We really appreciate you joining us. As far as getting to the topic of border security, as far as funding the wall through the cartel money, is anybody else on Capitol Hill looking at this as well? Obviously, this being something that you're behind. Who's on your team with this?
Ted Cruz has also spoken about it. As a rule, Democrats hate anything that would fund a wall, quote unquote. Even though the president offered a deal, giving them a deal on the DACA kids, much more generous than what Obama offered, but in exchange for securing the southern border. They didn't want it. They don't want it. Even though it takes care of supposedly an issue that's important to them, they still don't want it. So we're trying to see, again, if we can put this deal together otherwise in a package that's too hard to refuse. But somewhat it's contingent upon us confiscating more money than we are now. So if we can do that, we're hopeful that we'll get enough folks to say it's a good deal. It may take after the midterms, but we're hoping we can get them to say, yes, let's go forward with it.
Mm-hmm. And is it your opinion that the main obstacle in building the wall is funding that project?
Well, the main obstacle is Democrats don't want it.
Yeah, well, that's what I was curious about. You know, which is the higher hurdle? You know, getting the money or fighting the Democrats?
You know, the money in the scope of what Washington does, if you did $2 billion a year over 10 years, you could secure the border. And it's a lot of money, but Washington, we spend that kind of money in Washington, D.C. Yeah. The biggest deal is that Washington, D.C. Democrats don't want it. And even though it theoretically takes, in fact, it absolutely takes care of the DACA kids, they don't want to give Trump a victory. So now the DACA kids would be protesting outside of a Democrat's office saying, wait a second, Trump just offered us citizenship, a pathway to citizenship, and you didn't take it because why? Because you don't want them to have a victory?
Yeah, that's a sight.
The DACA kids are recognizing it.
Yeah, that's a sight. A perfect description of it. Well, Senator, thank you for joining us here on Offsides today. It's always a pleasure to have you on the show. And, of course, we always welcome you here. And we hope that all these things come into fruition for you. And we'll be looking forward to talking to you again.
Thank you, gentlemen. Appreciate it.
Thank you.